In this video, I'm going to show you 5 common things you might be doing that's making your hip impingement worse. Hey guys, my name is Dr. Kevin Vandy, specialist physical therapist with Competitive Edge Physical Therapy, and I've dealt with hip impingement myself. In fact, you can check out this other video that I've made all about the best exercise and drills you can do to overcome your hip impingement. But what if you're doing those drills and you still have pain? If that's the case, there might be everyday activities that you're doing that's making it worse. Ways in which you're continuing to have inflammation, causing the pinching and compression in at your hip. If you're doing the drills and you're working real hard but you're still having pain, this video is for you. One of the everyday things I see people do with hip impingement that's likely making issues worse is sitting with crossed legs. For instance, leaning back in a chair, crossing one leg over the other is a position that creates impingement in on the hip. Because you're flexing your hip and rotating your hip, you're bringing the ball and socket closer together, and that creates pinching and inflammation. But you might not feel it right away. When you bring it into position, it might feel okay. Maybe it gets tight or it gets sore after a few minutes, or maybe you don't even feel it then. You might even feel it later on that night, and you might say, well, I didn't do anything wrong. Well, sitting with crossed legs is a low grade but long duration impingement of the hip, and something you want to be careful from doing. If you want to sit comfortably and you don't just want to sit with your feet on the ground, you can put your legs out on a box or on a stool rather than crossing your hips, because that is going to put you in an impingement position and cause a low level of inflammation that can build over time and be a silent irritation to the hip that you might not realize. So if you're in an acute stage, you have pain at rest, or you have pain every time you squat, or even with sports, and you want some quick pain relief, one of the things you can do is just avoid crossing your legs, and that will lessen some of the irritation in on your hip. Another common hip impingement issue with sitting that I see a lot is when you're sitting in a low chair or bucket seat in your car and your knee is higher than your hip. So if I draw a line from my knee to my hip, you can see it's sloping down in this type of position. So if you sit with your knees elevated and your feet up on a stool, or you sit in a bucket seat of a car, or even slouch back into your chair with your knees up, all of those positions are going to put increased pressure on the hip joint and put you in an impingement position. To avoid that, what you want to do is you want to raise your seat up so that either your knee and hip are on the same line, or even better, your knee is slightly lower than your hip. Same thing in your car. What you want to do is you want to take the seat of your car, if you can adjust it, you want to drop the seat down and bring the back of the seat backwards so that you open up this space here in your hip. Anytime this space closes off, you come into an impingement position. Whereas if you can open up that area by changing the adjustment in your car and changing your work seat, you can avoid hip impingement during your work hours and during your commute to work. When you have tightness in your hip, tightness in your groin, pain in your groin, pinching when you squat, the feeling you get is you want to stretch your hip. You want to mobilize your hip. And one of the more common stretches you can see is what's called a figure 4 stretch, which is a stretch where you bring this leg across your body and then sit back onto your hip. This is exactly like crossing your legs when you're sitting in a chair, but now you're at an end range of motion and you're bringing your chest down to the ground, which really compresses in on the hip joint. Now later on in rehab, this can be a good drill when you're not having acute pain. But when you're in those initial stages and your hip is killing you and you might not even be able to find a comfortable position at night, this is a drill you're probably going to want to avoid for the short term, because it does put added compression and body weight in on the hip. So again, figure 4 stretch, if you're doing a lot of drills, it might be in yoga, or you might be stretching with a sports team, and your leg is crossed over and you're bringing your chest down over your hip, that is an impingement position and it can cause problems. So avoid it for the short term, not forever, just in the acute stage where you're trying to get out of hip pain. One of the other ways that you can encounter hip impingement or add compression to your hip It's when you're trying to do a squat, weighted or unweighted. And there are two things I'm going to show you with a squat that can have a drastic impact on reducing compression and pain in your hip. The first one, when you squat, it's common when you get all the way down to the transition moment in your squat to want to squeeze in with your knees and use your inner thigh muscles. It's common to want to squeeze in and drive up in a squat. Well, what we know about hip impingement is when you're loading your hip in a flexed position and you internally rotate, you can bring the two bones in your hip joint together and cause pain. So this, what's called adduction or internal rotation of the legs, compresses the hip joint. So you want to try to avoid that. Now, wearing a band around your knee is a great cue because you can spread the band or spread the floor when you do a squat. The other thing to do is just imagine taking your feet and trying to rip the floor apart or even trying to turn your feet outwards. Both of those cues activate your glutes, which help to externally rotate or move your knees out from the inward position. So as you're going down in your squat, you want to spread, 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 really rip the ground floor, the floor apart, rip the band apart, and then as you go to press up, that's when you really want to concentrate on keeping your knees out and not letting them cave in. So that's the first piece of advice for how to avoid hip impingement positions with squatting. One of the other common errors when doing a squat is to have too much anterior pelvic tilt, basically tilting your pelvis forward or causing a sway back. That position tilts the part of your hip, the cup part of your hip forward, and that puts pressure down on the ball and you get hip impingement. So what you want to do is before you come down into a squat, you're going to be in a hip hinge. You want to remove this arch from your back. So you don't want an excessive arch here. You can do that by tucking in your stomach, holding your abdominal muscles in, and make sure you maintain that position throughout your entire squat. Especially when you get to the end, it's common to see people really arch their back, and that significantly can add pressure to your hips. So just keep a neutral spine as you move through your entire squat motion. It can be hard to do, and in a previous video I talked about how to progressively make your squat better in terms of alignment by slowly moving through deeper ranges, keeping your abdominal muscles activated as well as your glutes. Hey everyone, I have one more tip for you, and this is for all the cyclists out there. If you're experiencing sharp pain, stabbing pain, hip tightness when you're cycling, this one's for you. So oftentimes when you want to ride fast or you just need a different position, you end up in the drop hoods, the down bars of your bicycle. And when you get into that position, you put yourself in a more forward position, and that automatically can add pressure to the hip, especially when you're up in your cycle stroke. That top 11 to 2 position on the bike, that's where you're going to get the pinch. So in the short term, you want to come up onto the crossbar or onto the hoods versus being in the drop bars, because that is a common hip impingement position. So it doesn't have to be always. You can definitely get back to doing it as your hip feels better, but in the short term, just stay out of the drop hoods because it will reduce compression in on your hip. All right, so there are some common ways I've seen clients throughout my career as a physical therapist, some ways I've seen them increase their hip pain when maybe they don't even know they're doing it. They can seem like they're insignificant, but when you do them over and over throughout the day, that could be the missing piece that if you're doing the best exercises and stretches and working on your core and hips and glutes, if you're doing all those things but you're still experiencing hip pain, those silent assassins, if you will, can be the hip issues that are making your pain continue when you're doing all the right things. So I hope you enjoyed this video. hit the thumbs up. Let me know you like the video. Subscribe to the channel. Be sure to hit the notification bell to get more of my videos. And be sure to comment below. Let me know if you've seen this in your own life, these movements that cause hip pain. And now that you've seen them, if you notice them more, and if by changing them or avoiding them, you get less pain. Thanks so much for watching. Be sure to check out this other video I made about hip impingement. It gives you the exercises I personally used to overcome my own hip impingement, and I sincerely believe they will help you. So be sure to check it out. Until next time, everybody, train smarter and perform better.